Thank you, everybody, for joining us today. This is the last planned Greater Manchester briefing this year. You've just got me today, but we're grateful to you all for joining. As you'll see in a moment, I think it's important that we are having this briefing today, just so that everyone has got clarity on the Greater Manchester picture ahead of Christmas and the break. Should we get straight into the slides, please? Thank you, Alex. So, colleagues, what you can see is quite a changed picture week on week, with a significant rise in the number of cases per 100,000 at the Greater Manchester level, but rises in all 10 of our boroughs. And what this represents is almost certainly the first phase of the Omicron wave in Greater Manchester, particularly point to Trafford, where you can see a very high case rate, but overall a substantial increase on the week, and obviously a new picture, a new reality for us to think about. If we go to the next slide. Slightly more encouraging in that the rise in cases amongst older people is not as steep, but nevertheless there has been a rise in cases amongst the over 60s, as you can see there in the final column. So obviously this is a picture that we've got to keep under very close watch. Should we go on to the next slide? This reflects what you've just seen. So there are kind of rises in all age groups, and the beginning of a rise in the over 60s, which until recently has been, as you might remember, quite stable. Still strongest amongst school age children, and between the ages of 30 and 44. That's where we're seeing the most growth across the GM picture. But overall, if you look at the right-hand side of the colour-coded charts, you will see that there's beginnings of a rise amongst all ages. If we go on to the next one, a change in picture here, although at a low level still, it's important to stress, and at a level that was much below what we saw earlier this year or last year. But obviously, we keep the closest of watches on what's happening within our care homes. But that's something just to keep an eye on. Again, I guess reflecting the picture, although we would, obviously we've seen the rise in cases this week, and we would expect there to be a lag in terms of what will kind of feed through to hospitals, a sort of 2 week or so lag. That's been the pattern throughout. What you can see here is a rise in weekly admissions, a small one, but nevertheless a rise, an increase more significant in the inpatient diagnoses. Overall, a stable position when we look at critical care beds, but a rise in patients in general hospital beds. So I think this basically is the position that we're at, and this is, I think, reflected nationally, that we don't yet know what the rise in cases will mean for hospital admissions, and that's very much where the national debate is at this particular moment in time. But I think it's fair to say we will see some change in those figures as this wave begins to feed through. On vaccination, a positive picture in that we continue to make real progress, not just on the booster campaign, but also evidence of an increase in the number of 18 to 49-year-olds coming forward for their first dose or getting their second dose, which is good to see. The booster programme has been a phenomenal effort across Greater Manchester, and at our emergency committee today, people were just saying the effort people have put into this is quite phenomenal. On Saturday, 33,000 doses were delivered across Greater Manchester, which was a GM record. 32,000 on Sunday. You can see that this is a huge uplift in the programme, and people are coming forward. What we wanted to stress today is to say to people, please still get your booster before Christmas. It's important that you do. It's the best way you can protect yourself and your family going into the Christmas period. If there are after effects, they tend to be mild for most people and short-lived for most people. It's definitely the right thing to do. So there is capacity in the system. We're running at full capacity, but there is still the ability for people to get vaccinations. And this brings me to a new service actually that we've just launched today that has actually gone live this morning, and we'd be very grateful if you, particularly our colleagues from the Greater Manchester media, the regional media, might be able to promote this phone number for us. It's a phone line, a support line, being supported by our colleagues at Greater Manchester Fire and Rescue Service, and we're really grateful to them for helping us with this. It's a helpline for people because all of the places where people might be able to get a vaccination don't show on the national booking system. And what colleagues on the end of this phone line will be able to do is signpost people to where they can get a vaccine on any particular day as close to their home as possible. So we're really pleased that this line has been stood up. As you can see, it will run from 8 to 6, starting today. It will probably follow the holiday period, so it won't be running on weekends or bank holiday, but will be running between Christmas and New Year. And we know our colleagues at Greater Manchester Fire and Rescue Service are working hard to make sure the right support is there. I think that's it for the slides. I'll just finish with a few general messages before turning to your questions, colleagues. So, as I said a moment ago, we did have the meeting of the Greater Manchester Emergency Committee this morning, and one of the main themes that came through was concerns about continuity, business continuity for public services over the coming period, given the relatively high levels of absence due to illness or self-isolation. So just to give you some of the figures that were reported to the meeting, we're looking at a 10% staff absence rate in the NHS for the reasons that I just gave. We think it's around 7% in Greater Manchester Police, slightly higher on the transport system in Metrolink, running at 15%. So all of this does give rise to a concern about maintaining business continuity in public services over the holiday period. But I can assure you that a huge amount of effort is going on and a huge amount of collaboration actually going on across the councils and the different public services to support each other, and we will be keeping a close watch on that through the Christmas period. Second point I just wanted to touch on is the Chancellor's package, which has recently been announced, or just earlier this afternoon. Certainly welcome as far as it goes, although it would feel as though at first glance it doesn't go far enough, particularly in respect of support for individuals. Now, we welcome the business support and we were calling for that, but for those staff who are being sent home from pubs, bars and restaurants because there isn't any work, there's no guarantee that those people will see any support passed on, and that is a real concern, because many individuals across Greater Manchester who work in hospitality, but not just hospitality, actually in events, in conferences, music, in other creative industries, obviously are seeing a huge drop in their income at a pretty devastating time of the year. And bear in mind, a number of these individuals were excluded from public support last year, so have really struggled this year as well. So a real gaping hole, it seems, in the package that's been announced, and we would urge the Chancellor to close it and give some support to people as they go into the Christmas period. So if I might, just turning to to other quick issues. Obviously, we are following closely the national decision-making process, and we don't have access at a Greater Manchester level to the emerging data about Omicron. And obviously, we've heard comments today from Sir Jeremy Farrar saying that it isn't yet fully clear what is known about the severity of Omicron, but particularly the implications for hospitals with regard to the levels of infection, and that picture is still only becoming clear. What we would say to the government is, given the situation that we have got and the uncertainty that people are feeling, is we do believe there needs to be clarity before Christmas on what the decisions are with regard to any further measures, and certainly as soon after Christmas as possible if they can't do it before. But it is something that needs to be dealt with quickly so that people know where they stand going into the Christmas break. Two final quick points, if I may. The first is something we've said before, but I do need to say again, a massive thank you to our frontline workers who are out there working in not just the NHS, but police, fire, on our public transport system, working in really challenging conditions, and we recognise that, and it's really important that I say, we know it's been another tough year. Probably this year's been harder than it even was last year. And we know how difficult it's been for you, but on behalf of everybody, just want to say a huge thank you. Also a thank you to the Greater Manchester public, because the evidence is that people are beginning to take sensible decisions to minimise the contact as requested by the government, and we are grateful to people for continuing to err on the side of caution. If people are visiting family over the coming days, we would emphasise the sensible measures that people can take. For instance, taking a lateral flow test before visiting family. It's important for people to order tests so that they've got some in. They are available at pharmacies. Also through the national booking system. That's just a simple thing that people can do. But there is clear evidence that people are following the guidance, as difficult as that has been for some of our businesses. We do believe more support is going to be needed from the Chancellor, because, as I say, it's not just hospitality, it's taxis, it's a whole range of other businesses that are struggling here. But nevertheless, the public are doing the right thing. We thank you all for it. And with that, Ross, I'm going to hand over to you to take us through any questions this afternoon. So thank you very much for listening, everybody.
Thanks very much, Andy. If colleagues in the media could raise their hand using the raise hand function at the top of the screen if they'd like to ask a question. I'll just give colleagues a little second to find that function and raise their hands if they want to ask questions. We've got Helena. I'm just going to open your mic and allow your camera now. Helena, if you just want to say who you are, where you're from, and ask your question.
Good afternoon. It's Helena from the Manchester Evening News. Please, can we get an update on bed capacity across the NHS system? The last figure that we had a couple of weeks ago was that beds were 93% full up across Greater Manchester. And secondly, in London, the NHS is predicting that a third of staff could be off by the new year. Have we done similar projections for the coming weeks in Greater Manchester? And if so, how worried are you about that?
Thanks very much, Helena. So just to let me just look on. I'm looking on our dashboard at the moment. What I have for bed occupancy at the current moment in time is 88% bed occupancy. That's the latest figure that I have got. I think what that reflects is a huge effort that's underway across the Greater Manchester health and care system to support people to return home if they are medically fit to do so. So there is a huge amount of work going on. working with colleagues in the community and voluntary sector to support people home, recognising that there will be probably extra pressure on the system as we're going through the break and into the early January period. In terms of expected staff absence, it's not possible to say is the answer, the honest answer. The SCG, the Strategic Coordinating Group, does have a very high focus on that whole question of business continuity, as I said. And if you look at if you consider the figures I gave you before, what you can see is quite a variable picture across different public services. The figure for the NHS has remained fairly constant for us. I think I gave a figure of 11%. Last time I did a briefing, 10% was the one we were given today. But there is a but. We don't know. We haven't yet experienced the full effects of the Omicron wave. As I've said to you in the figures, it's just starting, and the impact on our hospitals still is not yet fully known. So I'm sorry not to be able to answer it more precisely. It is an uncertain picture right now. But it is true to say that business continuity, service continuity is a significant preoccupation for the Greater Manchester system right now.
Thank you.
Thanks, Helena. I'm going to go to Tom. Tom, you should be able to open your mic and your camera now. If you just say who you are and where you're from.
Hi, Andy. It's Tom from Hits Radio. Just first of all, we've spoken to businesses today, and particularly hospitality, who are unsure as to whether to order stock in for New Year's Eve in particular. What would you say to businesses in Greater Manchester who are unsure, I guess in light of the Chancellor's announcement today? And secondly, you touched on the efforts of our frontline workers. What would your message be to the vaccinators, the volunteers who perhaps won't be having that festive break, to make sure that jabs continue to go into people's arms and protect Greater Manchester as Omicron continues to spread? Yeah,
thanks a lot, Tom. I think it's a very difficult picture still for businesses. So they've got half of an answer today with some of the support that's being made available to them, but they've not yet got the whole picture because we don't know what might lie ahead. And that's why I repeat what I said at the start, the need for clarity before Christmas. The government needs to make a decision as to what is coming, what it expects to be asking of people come the new year, so that everyone can be fully in the picture in terms of what's coming. As I say, I think we need to make sure that any measures, if any measures are introduced, but if they are, that they're proportionate, that they're evidence-based. We are at a different position than we were last year with regard to the vaccination programme and the booster campaign. But I just think, be honest with people, just be clear with people, and the sooner the better is, I think, the call that we are hearing from businesses. So what I would say to businesses, we hear your call. It's why I've said today that we want clarity before Christmas, so that people can go into the break knowing where they stand. In terms of the volunteers, I mean, as I said, it's been a phenomenal effort, and I can't stress enough how much people were kind of in awe of it, really, on the meeting today, and the reports of what's been done across the Greater Manchester system to massively increase the capacity across our system in the last few weeks. It's just been huge. Phenomenal was the word people kept using. And yeah, there's going to be people out there when everyone else is taking a break, still supporting the vaccination effort. And we can't thank you enough, because we know, with every jab that's given, January might just become a little bit easier for somebody working in the NHS. It's every jab matters, basically, and it's why we just encourage people to come forward. The supplies are there, the teams are there. the evidence is there. I mean, look at the evidence, in terms of the risks that people are running if you're not vaccinated. All of the evidence is it's people who are unvaccinated who are much more likely to be in hospital or only have had one dose. So the people out there are hugely kind of helping the country through all of this, and we say we see you, we thank you, we appreciate you, and without you, I genuinely don't know where we would be. You've done a phenomenal job. Our figures are getting better and better. Of course, we're working to support vaccination rates in areas where they're lower, but overall, I think we've got a pretty encouraging picture across our 10 districts now, and it's down to the people who've been working flat out on this. So a massive thank you to you all.
Thanks, Tom. I'm going to go to Kevin Fitzpatrick at Radio Manchester. Second, Kevin. Kevin, you should be able to turn on your camera and your mic now.
Hi, Andy. It's Kevin at Radio Manchester.
Hi, Kevin.
Yeah. Got a couple of things. The first one is on people who are vaccinated still needing hospital treatment. Have you got any figures that you can give us or details of what percentage in Greater Manchester hospitals have been vaccinated to some extent? I think nationally the figure people are talking about is around 35% haven't had any vaccine at all, which you might expect based on the narrative that a higher percentage of people in hospital wouldn't have had any vaccine. So some clearly people who are vaccinated are still ending up in hospital, aren't they? So do you have any figures on that? And then what period are you looking at as the prospective peak of this next wave in Greater Manchester? Are we talking just into the new year? Do you have any details on that? And then one more on the vaccinations. We were talking to Manchester City Council yesterday. They were saying still 200,000 over 12s haven't had any vaccine at all. In Rochdale, I think it's 50,000 over 12s haven't had any vaccine at all. So actually across Greater Manchester, there is a huge number of people, isn't there, who don't have any vaccine at all, and it could end up poorly in a way that requires hospital treatment, I suppose, if that doesn't change.
Just to make sure I've got those, Kevin, it's vaccination levels of people who are unvaccinated in hospital was the first question, wasn't it? Yeah.
Second one, when are you expecting, is there any expectation of when in Greater Manchester you're preparing for the peak of this wave?
Yeah, and then the under
and
12s.
the third one, yeah, I mean, what is the concern about? We're talking hundreds of thousands potentially in Greater Manchester, aren't we? Don't have any vaccine at all. What's the level of concern about that?
So thanks, Kevin. I'm afraid I'm probably not going to be able to answer these questions precisely. On the unvaccinated, I think it's just the national figure. We don't have a Greater Manchester breakdown, and certainly was not given one today. So I wouldn't want necessarily to speculate. There is some evidence that it varies as well according to the mix of vaccines that people have had. There is a variation, isn't there, in the in the rate of hospitalisation. So I wouldn't want to speculate. And also, I think the important thing to say, Kevin, is that with Omicron, this is what people are looking at right now. It's not clear the extent to which the Omicron wave is leading to hospitalisation. So we are in a quite a difficult picture on that right now. In terms of the wave, again, the point was made this morning that is this a sort of high spike and then a kind of does it come down quickly on the other side? And that's certainly something people are speculating about. But we were encouraged not to fall into the trap of thinking that that's what it will end up being. What we're seeing is that very rapid increase that the experts said we would see with regard to the doubling rate. The R number is between 0.9 and 1.1 in the northwest. So we're seeing that high rate of spread. We just don't know at this stage how this wave will play out, and that's just, I'm afraid, an honest answer. In terms of the levels of vaccination, particularly amongst younger people, that we have a map that's presented every meeting, and we've seen the areas where the vaccination rates are lower, and obviously there's a huge amount of work going on in those areas to increase it. However, it is also true to say that the highest case rate is in some of the areas where the vaccination rate is quite high. So Trafford and parts of South Manchester, that's where we've seen some of the highest rates of cases at the moment. So I think the point was made today. It's important not just to make a sort of, it's the two things that don't correlate completely. And Omicron is getting through to some degree with regard to the vaccine. However, there is evidence that people who've had the vaccine, certainly 2 doses or preferably 3, are much less likely to have more severe complications from the virus.
Thanks, Kevin. I'm going to go to Alice now. Alice is currently the last question, so we will finish after this unless others put their hands up. Alice, you should be able to open your mic and ask your question now. If you just say who you are and where you're from.
Hi, Andy. It's Alice from Global Radio. Couple of questions, really. When we go back to last Christmas, obviously, a lot of people sort of accepted that last year Christmas was going to be a lot different to obviously what we've had previously due to the introduction of coronavirus in a sense. This Christmas, people were expected to sort of reunite and obviously make the most of this year because we didn't get last Christmas properly. Now, this Christmas, in a sense, feels ruined for so many people. So many people are so fed up. We've got the vaccination programme, though. We've now got the booster rollout. So what's your message to those who are really at breaking point? Because there's a lot of people now obviously isolating due to the Omicron rise. It feels never ending at the minute. And I don't know sort of obviously how you can reassure people that there is light at the end of the tunnel, because at the minute it doesn't seem like there is anything to sort of cling on to, if that makes sense. People are losing hope. And sort of to add on to that, what are your hopes for the new year for 2022? I guess that a lot of people weren't expecting to still be in such a huge pandemic situation, which we obviously unfortunately are. So what are your expectations and hopes for 2022 as well?
Thank you, Alice. They are very good, if slightly challenging questions, because it's not a position that any of us wanted to find ourselves in. And actually, I don't think we expected to be in, did we? I've been saying recently that, I feel 2021 has been a harder, darker year for people than 2020. 2020 was up and down, wasn't it? And we went through some really difficult kind of moments and challenges, and we all did. But actually, this year has been really punishing in many ways, and we've actually felt the full after effects of 2020, haven't we, this year? So I understand what you're saying when people are feeling, feeling the fatigue of it all, and the kind of sense that this Christmas isn't going to be what we wanted it to be. Well, it still can be, as long as people are careful. Obviously, people can still have a Christmas. I did make that point before about lateral flow tests. We're all much more used to using those this year, aren't we, than we were last year. So why not all take one, and then people can have a Christmas with a bit of peace of mind, can't they? If everyone's taken a test and it's come back okay, people can gather as a family and do so with a good degree of confidence. So that's one thing. I don't think we are in the same position, Alice, as we were last year. But for the reasons that you gave, it's why I'm saying to the government, think carefully about what they announce, because obviously we have to consider the spread of this Omicron variant and the risks it poses to individuals and to the NHS. But we also have to consider the impact on people's mental health of restrictions. That cannot be ignored, as well, of course, of the impact on the economy. So none of it's easy. And actually, to be fair to the government, I don't think it is an easy judgment to make. But actually, it has to be made. There has to be a judgment about what is the right level of caution at this particular moment in time. So, you know, it's why I'm saying let's have clarity before Christmas or very shortly after, so that people know where they stand. I think we are learning more, aren't we, about how to live with this. We are more empowered this year than we were last. The hope is the vaccine program, because it is working. You know, the figures I gave at the start for over 60s, it shows that the most protected, because the people most likely to have had the booster as well, are largely protected from this. And that is obviously a sign that we're beginning to beat this virus. I think that progress will continue in 2022, and you know, and slowly we will come through it. I think a reflection on this year is that language around Freedom Day was always going to be wildly over optimistic. I think we made that point at the time. You know, the expectations, I think, were changed in the wrong way at that time, and I think we're struggling a little bit with that now. That said, we are learning more all of the time, and you know, the resilience of our communities is still there. You know, and we thank everybody in our voluntary and community sectors that are helping people through. So I think people can have hope going into 2022. Alice, I think it will be a better year, I think, than 2021. I think 2021 has been the year of when we felt the after effects, but I think 2022 we will come through stronger and stronger, and ultimately we will be out of this situation hopefully before too long. So thank you for that question. It's a really good question, and I do think people can have hope going into this Christmas. But the way to secure a better early part of 2022 is just to be careful, to take those precautions that I mentioned, to minimise, yes, see family, but minimise the mixing, take lateral flows where you can, get your booster done. You know, we can all give each other hope if we all do all of those things.
Thanks, Andy.
Thanks Alice.
I'm going to go to Yoshi. You should be able to open up your mic and camera now.
Hi, Andy.
Hi, Joshi.
I think a lot of people are sort of looking for a steer from their leaders, given that the government hasn't made any decisive moves in terms of hard and fast regulations or changing the rules. And clearly everyone wants to be able to go home to their family for Christmas. But on this sort of softer question of, if someone in Greater Manchester has a night out planned in the next few days, I mean, we all know like the 24th is a big night out, and a lot of people go drinking that night. What is your advice to someone in Greater Manchester who has a night out planned in the next few nights? Should they go or should they cancel it?
I think it's a judgment that people will have to make themselves. I mean, it's why I'm saying we need clarity from the government, Josh, at the moment, because at the moment we're all a little in the dark. You know, I haven't seen the data that the government has with regard to Omicron, its severity, the link to hospitalisation, the evidence from overseas. I mean, we haven't seen that. So, you know, I've got to be careful not to, you know, jump to conclusions that I'm not able to make. So in this kind of, in a slight limbo period, it feels at the moment. And I think people have to go with what they've been asked to do, and they've been asked to minimise socialising. Now, obviously, that's not saying stop it, is it? It's saying be careful, minimise it, and I think people are doing that. If I'm honest, I was out last week, Josh, in the city centre on Friday night, and I, you know, didn't do what I was planning to do, but I didn't sort of completely cancel everything. I just think people have to be careful. I noticed that there was it was not what you would have expected from the Friday before Christmas. You know, there was a very different atmosphere in the city. It was much quieter. So I think people are being sensible. If they are going out, they're going out in perhaps smaller groups. And obviously we know that the cancellations that our hospitality sector have experienced are pretty significant. So I think, as I said, I think people are being sensible by and large, and that's why I thanked people at the start of it. You know, people need, I think, a little bit more of a steer from the government and more clarity And it's, I say, it's not about cancelling Christmas. It's not about cancelling all of your plans. That's not what people are being asked to do. But it's about minimising, taking sensible precautions, lateral flows, getting the booster. Those are the things that people can do. To go out socialising and do none of those things, well, I think that is that is to take a risk with not just your own health but other people's health as well.
Thanks very much. I'm going to go to Jen. Jen, you should be able to. Second, you should be able to undo your mic.
Yep. Can you hear me all right?
Can indeed.
Yeah, it's Jen at the MEN.
Hi, Jen.
Hiya. Just 2 questions. One on the health service. NHS England, I think, sent something around local areas last week saying, referring to what you talked about before about discharging people who are ready to go home, and suggested that if necessary, places look at using hotel accommodation. Do you know whether Greater Manchester has done that, whether it is looking to commission hotel space in order to free up hospital capacity? And the other question kind of follows on from what you were saying then, really. If you, I realise that you don't have access to all the data that the government has got, but you obviously have got a lot of information, and you'll seen what Sage has been saying and so on. If you were in Downing Street right now, what do you think you would be doing in terms of restrictions and their timing? Thanks.
So thanks, Jen. So on the first question, I know that a huge amount of work is going on this. Whether or not colleagues have used hotels as part of that, I don't know, and I'd have to get an answer on that. Then we'll get back to you on that one, Jen. Unless anyone is on the call who does know, I don't think we've got colleagues who could answer that on the call. So Jen, if you could leave that one with us, we will come back to you and give you that information if we have it. I'm not aware of it, and I don't think it's happening, but it could be that there's a plan in hand. I honestly don't know. On the second part of your question, I mean, I'm just going to come back to the point about the data. It's very, very hard at this point in time to to say what's needed, given the variables have changed compared to these judgments last year when we didn't have a vaccine, and it was a very different scenario. When we have a large part of the population boosted as well, it's you've got to be proportionate. All I would say is, what would I be doing if I was in Downing Street, to answer your question the way that you put it? It's a decision. I think clarity is what's needed. I think the position is unclear, and we heard Sir Jeremy Farrar say so on the radio this morning, and certainly we reflected on that in our meeting this morning. I just think clarity before Christmas as to what the government is asking of people going through this period and into the early part of January, I think is needed, and I will be preparing for that. I think it is linked to the business support situation. I think I would be making efforts to support not just hospitality, but the taxi trade, conferences, music, but also aviation, which I know continues to be hit again by what's happening. And there's this whole question of individuals. We are seeing individuals losing wages, and I don't believe the Chancellor's announcement today has fully, it hasn't answered that question, and they need to give a better answer on that. So I'm sorry I can't give you a fuller answer. It's just obviously without that expert analysis of the Omicron data, and the extent to which the vaccination programme mitigates against the risks. We would have to see that analysis to decide what that would mean in terms of any potential further measures.
Thanks, Jen. I'm going to go to Leisha from Granada. You should be able to open up your camera and mic now, and this is the final question unless anybody else comes forward in the next few minutes.
Thanks very much, Ross. Hi, Andy. Leisha from Granada Reports.
Hi, Leisha.
You mentioned already the limbo period local authorities are in. I know we just don't know how this wave could play out.
But is there a point at which you'd call for a circuit breaker? If so, what is that point? Or is there a level of restrictions you think we as a society just can't return to again?
So it's again back to the data, Leisha. I mean, we really do at this point in time, I think, have to make sure that any changes are very clearly evidence-based and proportionate, given the reasons you just gave a moment ago. I think the impact on people's mental health does have to be considered alongside the impact that the virus is having. So it's a more complex judgment, I think, than was made last year. And the question would be, would a circuit break actually work? If that means a 2-week break, would that just mean that the wave comes at a different time in January once that's over? So I don't think it's at all clear actually what is the right intervention here, and we are just simply not privy to what the government is being given on this. So I think for the reasons that you gave, I think we do have to work to balance all of the factors that I've mentioned. It's clearly a cause for concern what we're seeing in London, and obviously the figures that we're beginning to see here. But there is another side of things where people say the overseas evidence is showing that it's not following through into levels of hospitalisation that we saw in earlier waves. So, all of that needs to be considered. Whatever is announced has to be something that is clear, understood, proportionate, evidence-based, and I think that's the point that we've reached in this pandemic.
Thanks, Andy. That's all the questions. So we're ready to finish whenever you want.
Yeah, well, that's it. I think, Ross, I can't see any other hands up. So thank you, everybody, for attending. If you wouldn't mind, please do promote that vaccine helpline number for us. That's a very much GM initiative. We'd be really grateful if you would do that. So, thanks for not just attending today, but all year round, actually. As always said on this call, your reporting of what we've been doing has been much appreciated by all of us and has really helped us through this. So I'll just wish you all, I hope you will get a break, some of you. I hope you have a good Christmas as much as you can do in the circumstances. Let's all hope that 2022 brings a bit more cheer than 2021. But anyway, thank you, everybody, and we will see you at the next briefing. Thank you very much, everyone.